Good afternoon, everyone. Welcome to this webinar for creating awareness related to cervical cancer. This webinar is mainly for the patients, and the reason why I took up this topic was why is this important is because cervical cancer is the most important causes for cancer amongst Indian women. Also, this results, it affects nearly 1 lakh women every year in India, and out of these, nearly 70,000 they die in India every year. So we can consider that almost one woman dies due to cervical cancer in India after every 8 minutes. So this becomes an important health related problem as far as Indian population is concerned. Worldwide, if we see, then breast cancer is the most important causes for cancer amongst women, and cervical cancer, it comes only second worldwide. But in India, cervical cancer is the prime most important causes for death among Indian women. And the reason is clear, mainly because there is no proper screening program which is available in India for cervical cancer screening. Whereas in most developed countries, for example in UK, US, in Australia, there's a proper developed screening program wherein women, they will get invitations from the hospital to attend the screening, and depending on the time, because normally the screening, it should occur after every 3 years for women who are between 25 to 49 years of age. So they will get this invitation letter to attend the screening program at their home itself. So the screening program, you can see, is so well developed in these nations, but in India we don't have a cervical cancer screening program. So it is the responsibility of the women themselves as well as the healthcare workers to ensure that they get the screening done on their own. So talking about the anatomy, so if we just look at the anatomy, you can see that this is the normal female reproductive tract, and you can see that the upper part is the uterus, this is the tube, and these are the ovaries here, and this lower part or the neck of the womb or the neck of the uterus, this is the cervix. And if we look from down below, then this is how the cervix looks, and this is the part which is usually affected by the invasive lesions. So this is the transformation zone where you can see where there is a transition between the cell types, because there's a transition between the squamous epithelium and the columnar epithelium here at the point of the transition zone. So this is the area where the malignant transformation is more likely to occur. And if we look at this, we can see that as the cancer grows, it spreads not only the cervix, but it also spreads in and around the adjacent areas. So in the stage 1, cancer is limited mainly to the cervical areas, and as the cancer, it grows, it becomes more advanced. In the more advanced stages, it starts also involving the parametrium or the surrounding tissue and the pelvic structures. And the most important cause for carcinoma cervix is the human papilloma virus, or what is known as the HPV infection. And there are different subtypes of HPV which are there. An HPV infection is the infection which is most commonly encountered among sexually active women. So almost all sexually active women, they will be having infection with HPV sometime in their lives. But not all HPV infections, they will result in carcinoma cervix. Maybe less than 1% of cases where infection has occurred by human papilloma virus will actually land up developing a pre-invasive lesion and subsequently a invasive cancerous growth. So what are the various risk factors for development of cervical cancer? The first is the multiple sexual partners. Promiscuous behavior, that is one most important cause for development of cancer cervix. Starting sexual activity at an early age, that is the second most important cause. Third is multiparity with poor birth spacing between pregnancies. So, multiple pregnancies and which are very closely spaced, not properly placed, that is one of the main causes which is responsible for causing cervical cancer. This has been responsible for causing cervical cancer in India, especially. And this is so because every time the baby is born, it passes through the birth canal, it will cause injury to the cervix, and repeated trauma to the cervix combined with HPV infection, it may act as a risk factor for development of cervical cancer in the long run. Another important risk factor is low immunity and presence of other sexually transmitted infections. So these sexually transmitted infections, they could be syphilis, gonorrhea. Low immunity could be because of HIV infection or some other infection which is resulting in suppressed immunity in the women. Then history of smoking or long-term use of oral contraceptives is another risk factors. Low socioeconomic status or poor menstrual hygiene. Again, this is important cause, important risk factor for cervical cancer, especially in India. And poor hygiene, basically the menstrual hygiene becomes very important in these cases. So if proper use of sanitary pads, tampons or menstrual cup is not done, then that is one cause or one risk factor for development of cervical cancer. So signs and symptoms. Irregular bleeding in between periods is the most important sign and symptom. Again, it's not the heavy bleeding which is a sign and symptom of cervical cancer. It is irregular bleeding, or what we call as the intermenstrual bleeding, or bleeding which is occurring in between periods. So it could be spotting, spots, or in between she may have periods and then again after a few days there may be some bleeding episodes, again it stops, or after she's having sexual intercourse she's having bleeding, again that is another important sign and symptom. Then blood stained foul smelling vaginal discharge, that is another thing which women they often ignore and do not take that into consideration. But if it is blood stain and it is foul smelling, then you must visit your gynecologist, you must visit your doctor to consult what could be the likely cause. Again, cervical cancer is most commonly encountered amongst women in the age group of 45 to 55 years. So it is less commonly encountered in younger women. But it is usually not encountered after 65 years of age also. So postmenopausal bleeding usually may not be associated with cervical cancer, but if postmenopausal bleeding does occur, then you have to rule out cervical cancer, because cervical cancer in women after menopause may result in postmenopausal bleeding. Again, pelvic discomfort or dyspareunia, that is discomfort or pain during sexual intercourse, that could be another sign and symptom of cervical cancer. So investigations which could be done when you are suspecting a case to be suffering from cervical cancer: pap smear, colposcopy. Pap smear, we'll be talking about pap smear later in detail, so I'll not be touching upon this, because pap smear also, not only it's important for investigation or not only it's important for diagnosing cervical cancer, it is also important for diagnosing the pre-invasive lesions. So pap smear also acts as an important screening test for cervical cancer. Then colposcopy, which is basically microscopic examination of cervix. So if you are suspecting that the woman has cancer, cervical cancer, you'll do a pap smear, and if you see suspicious lesions on pap smear, then you go ahead with a colposcopy. This then is followed up by a biopsy, in which you will examine under the microscope to see that there are no cancerous cells, and in case the cancer has spread to the adjacent areas, a CT or an MRI would be required to check the metastasis or to check the spread of cancer to the adjacent tissues. So, treatment, if a person is diagnosed with cervical cancer, you have to do staging. And based on staging, basically means what is the extent of cervical cancer. So, in the early stages, what is done is usually surgery, wherein they'll remove the cervix, the uterus, as well as the ovaries and the fallopian tube. So, a radical kind of hysterectomy is done. In the more advanced stages, surgery may not work so much, so you have to give radiotherapy to the women. Sometimes you may also require to give her chemotherapy. So that you do not reach this stage wherein you require surgery, radiotherapy, and chemotherapy, there are some preventive measures which can be taken to prevent the occurrence of cervical cancer. First is safe sexual practices, having safe sex, that is, use of condoms, having or participating in proper cervical cancer screening programs, which basically includes the pap smear, which again we'll discuss in details. Stopping smoking or stopping the drug of abuse is another preventive measure. Maintaining menstrual hygiene, so proper use of tampons, sanitary pads, menstrual cups, and you do not keep them for prolonged period of time. You keep changing them after every few hours. That is very important. And last but not the least, the HPV vaccine. Two vaccines are basically in practice in use, which is Gardasil and Cervarix. And these are usually, there is a program in UK and US wherein the girls in the age group of 9 to 12 years, they are vaccinated. In India, we do not have any such program, but these vaccines are available. Again, it is the discretion of the pediatrician whether they feel the girl is at high risk and she needs to be vaccinated. But once she becomes 26 years of age, the use of vaccine becomes quite, it's not useful anymore after 25 years of age because she's sexually active and anyway she would have acquired HPV infection. This is the evidence, what it says. So talking in detail about pap smear, so you can see here, this is a picture which is showing pap smear, and an instrument called a cervix or a cervical brush is used to scrape the cervical epithelium, and this is then subjected to a histopathological examination to observe the microscopic picture of the cells and to see if any cancerous cells are present or not. And if we see, then this is the cervix and this is the epithelium. You will be basically scraping the instrument through this area, and the cells which are collected are then, they are put in a vial containing a preservative, which is then transported to a laboratory wherein then the slides are made through this preservative sample, and the slides are examined under a microscope wherein you will see the cancerous or the precancerous cells. And the instrument which is used for scraping, this is the cervical broom or a cervix, and it is usually after you scrape the cervical epithelium, at this point you will break it and put it in the vial itself, which is containing the preservative fluid. So this broken up area as well as the cervical preservative, the pap preservative, the thin prep preservative would be sent to the lab, and then this would be examined, made into slides and examined under the microscope. So what are the benefits of getting a pap smear? This helps in detection of pre-invasive or precancerous lesions. So they are treated at an early stage. So the lesions, they would be treated at a much early stage before they become invasive or before they become cancerous. And the treatment is also easier. You do not require extensive surgery or radiotherapy or chemotherapy. You have simple procedures like cryosurgery, wherein a probe is a cryo probe. It is basically a kind of treatment wherein the cells would be frozen to death and they will die eventually. So these kind of simple therapies are used for the pre-invasive lesions, and it is not as bad as, having a cervical cancer per se. And also there is availability of time, because it takes nearly 10 to 15 years for a pre-invasive lesion to ultimately develop into an invasive lesion. So women has a lot of time. I mean, it does not become immediately urgent that as soon as she develops a precancerous lesion, she needs to undergo treatment. There is a little waiting period which can occur, because the progression to a malignancy may take place in about 10 to 15 years. So when to get the pap test done? Pap test is usually done at 3 yearly intervals between the age groups of 25 to 49 years. This is as per the NHS or as per the NICE guidelines UK. In India, as I told you previously, we do not have any screening, proper screening being done. Women, they get it done themselves when they feel like it. But in the UK, the cervical cancer screening program, according to that, 49 to 65 years, it is done after every 5 years. And also, when the pap smear is done, at that time, HPV testing can also be done on the same sample if the doctor feels the need. In some situations, an HPV test will also be done on your pap cells, on the cells which are taken at the time of pap smear. So that was all for this session. So thank you so much for attending this webinar. And just to tell you that this webinar was the first session for the initiative Let's Talk Women's Health, which is an initiative for empowering and enlightening the women through education. So, educating the women for their common health related problems, that is the motto of this initiative. Self awareness and spreading awareness matters. And through this initiative, I aim at spreading awareness through your own self as well as around you. Becoming self aware is a starting point for self improvement. So, if you have any issues related to this webinar or related to any health related topic, this is the number here. You can WhatsApp me your issues and I'll be happy to deal with those issues. So, with that, I will end this session and thank you very much for being here.